I wanted to introduce you to RAD 205 pathology course, and in order to do that I would like to go over some basic terms and definitions about different pathologies. First, we'll start with disease. Disease is basically any abnormal disturbance of the function or structure of the human body. It can result from some type of injury, and you may not think of a disease process as an injury. When we think of injury, we tend to think of just trauma, but there are some sort of an injury to the cellular structure of the body that causes diseases. So pathology is in a sequence of events producing cellular changes that ultimately lead to an observable thing we see are known as manifestations. So when you think of manifestations, think of those things we can see. Observable changes resulting from cellular changes in the disease process. It's much like our image formation in radiography. We have a latent image that's contained in our imaging cassette, whether it's CR or film screen, and when we develop so that we can see it, it's referred to the manifest image. So hopefully that will help you remember these terms. Signs and symptoms you guys have probably heard of before. A symptom is the patient's perception of what's going on. A sign is something that's visible, a manifestation that can be found by a physician during an exam. A syndrome is a group of signs and symptoms that characterize a specific abnormal disease. And asymptomatic basically means that there are no symptoms at all. Etiology is the study of the cause of a disease. These diseases can be in many different forms. Nosocomial infections are those that are acquired in or from a healthcare environment. So if the patient acquires a disease or an infection while in the hospital, it would be considered a nosocomial infection. Iatrogenic is adverse responses to medical treatment. So if they don't respond to medical treatment itself, it's called iatrogenic. Idiopathic means there's no causable factor identified, so they have a disease process, but no real cause can be identified that makes the treatment much more difficult in that case. So when we are trying to identify a disease, we try to make a diagnosis. Not us per se as radiographers, but the doctor does, and we do assist them in what we do. Diagnosis is the name of a disease an individual is believed to have, and the prognosis then is the predicted course and outcome of that disease. Oftentimes, medical facilities and healthcare facilities want to keep a record of diseases. Epidemiology is the investigation of disease in large groups. So if there's an epidemic that's happening in a larger group, prevalence is the number of cases found in a given population. So if I said 3 out of 10 people get the flu, then the prevalence of the flu is 3 out of 10. Incidence, it refers to the number of cases found in a given time period. So if the incidence is more often and rapidly occurring, then the incidence is high. We also have to monitor trends. The agencies that take care of that record keeping are the National Center for Health Statistics and the Center for Disease Control and Prevention. They all kind of track, monitor, and report these trends and findings on diseases. And when they are monitoring these diseases, you might often hear them talk about the mortality and morbidity rates, and they are very different. Mortality rate is the number of deaths caused by a particular disease averaged over a population. And just so you know, chronic diseases are the leading cause of death in the United States. Morbidity rate, on the other hand, is the incidence of sickness sufficient to interface with an individual's normal daily routine, but it may not kill them. So mortality is death caused by a disease, and morbidity is life-altering but may not be fatal. There are several disease classifications. Those are congenital and hereditary, inflammatory, degenerative, metabolic, traumatic, and neoplastic. If you do go on D2L, you will see an assignment on disease classification that you are able to submit to the Dropbox when completed. So look for that assignment and submit that by the due date. Oftentimes when we talk about diseases, we use a lot of our medical terminology. We always use root words when talking about pathologies and different disease processes. On this slide, tumors always end in oma, but where these tumors originate or come from, the common root words for medical terminology, and there's a chart that discuss these. If you look down at the bottom, one of the more common ones for radiography would be tumor in the bone. That would be osteoma, osteo meaning bone, oma meaning tumor. And that's the way the chart sort of works. So you can read those on your own, but I would like you just to be familiar with where these cells of origin are and what the root word corresponds to them. We also talk about disease processes in terms of what happens to the cells that are damaged. I mentioned this in the first slide, that disease is something happening or an injury to some cellular organism, and it cannot be necessarily traumatic injury, but a cellular injury. When we say that cells atrophy, that's a decrease in cell size. The opposite of that is hypertrophy, and that's an increase in cell size. Hyperplasia is the increase in the number of cells. Metaplasia is the conversion from one cell type to another, and dysplasia is an abnormal change of mature cells. And that concludes the introduction PowerPoint and lecture. If you have any questions, please contact me. And again, please do look for that classification assignment and also the first quiz over the introduction. Please contact me if you have any questions. Thanks.